Hello and welcome. And when you see me here, you know it's Matters Health. And today I want us to discuss a very important topic. And as I have alluded earlier, that we'll be breaking down the danger signs into trimesters. So the danger signs in the first trimester, danger signs in second trimester, danger signs in the third trimester, and then danger signs postpartum, that is after delivery. So today I want us to look at the danger signs in the first trimester. Now, if you're new here, please consider subscribing to our YouTube channel and turn on the notification bell so that you're able to be notified every time we upload a new video. And on our YouTube channel is Doctor on Wheels. You can also follow us on our social media platforms at Zawadi Premier Hospital _Ngong for our Instagram, and Zawadi Premier Hospital Ngong for our Facebook page. So before we continue, I want us to listen to some words of wisdom from Matthew chapter 16, verse 24. The Bible says, "Then Jesus told his disciples, 'If anyone will come after me, let him deny himself and take up his cross and follow me.'" So let's dive into it. First trimester danger signs. So first trimester is basically the period from fertilization to around 12 weeks of your pregnancy. Now, this period is very important in pregnancy because this is the period where the organs are being formed in the process, what we call organogenesis. So we have the organs being formed during this period, and therefore anything that goes wrong in that process basically can lead to this baby being born with a lot of malformations that can lead to congenital anomalies that are not even compatible with life. So you need to be very careful on what you eat, what you drink, okay, the things that you do that might cause this baby to have issues with the development, okay, exposure to radiation, type of medication. There are some types of medication that are not recommended for you to take during the time when you are pregnant, and especially the first trimester or the first 12 weeks of your pregnancy. So what are some of the danger signs that you need to be aware about during this time? So number one by far is vaginal bleeding. So vaginal bleeding can just be minimal vaginal bleeding, and it can be as well some copious amount of bleeding. And as well, this bleeding can also be associated with abdominal pain, but we are going to discuss abdominal pain in details later. But in vaginal bleeding, the first type of vaginal bleeding is what we call the implantational bleeding, which is just some minimal spotting that takes place within some few hours. It's mostly painless, okay? It's a bright red, and it takes place for just some few hours, and it's very minimal. It's just some spotting, and it takes place around the 6th to the 12th day after fertilization. So after fertilization, and I'm going to do a separate video on the menstrual cycle so that we are able to know exactly at what time does the fertilization take place. Okay, so and then the bleeding can the second type of bleeding as well that you can experience during this. So this first one, implantational bleeding, to some extent, quotes and quotes, we call it normal, okay, because implantation has to take place for that baby to be able to grow. So quotes and quotes, we call it normal. But then the abnormal one that you need to be aware about, okay, is the bleeding that is indicative of a miscarriage. So it can start with some spotting associated with low abdominal pain. Now, the types of miscarriages that and which we will discuss them in detail probably in a separate video, the types of abortion and what causes those abortions, is number one is inevitable what we call threatened abortion. So threatened abortion means, or threatened miscarriage means, that the placenta has not detached from the wall of the uterus. So there's some bleeding probably around the placenta, but the placenta has not detached from the uterus. And therefore, if good care is given to this mother, it means the bleeding can stop and the pregnancy can continue. And then the cervix, of course, is not open. So the second type of miscarriage is inevitable miscarriage. So here, the placenta has already started detaching, okay? So it can no longer attach itself. So it has already started detaching and the cervix has already opened, okay? So basically, this pregnancy is coming out and there is nothing we can do. So what we normally do when you come to the hospital, we just help the pregnancy to we just fasten the process so that the bleeding becomes lesser and lesser and the pain basically reduces faster. And then the other pregnancy that you need to, the miscarriage that you need to be aware is incomplete miscarriage. This is where parts of the pregnancy have already come out and parts of the pregnancy are still in the womb. And therefore, what we normally do is we go ahead and remove the rest of the membranes and the remains of the pregnancy. And then the last one, for the purposes of this, is complete miscarriage. So with complete miscarriage, basically everything has come out, okay? And then the other one that you need to be aware of that can as well cause pain and bleeding is when you have ectopic pregnancy. So anytime you experience any form of bleeding in pregnancy, and especially the first trimester, do not wait at home. Please go to the hospital. In the hospital, you're going to take a very good history. We're going to do a very good examination for you, and then we will be able to do some tests as well, like an ultrasound, to be able to look at the status of that baby and advise you accordingly and be able to manage you well as well. Okay, so that one is by far the most important type by far the most important danger sign that you need to be aware of. Okay, now the second type danger sign that you need to be aware of is severe abdominal pain. So abdominal pain can be either as a result of infections, okay? Now these infections can either be like a urinary tract infection or pelvic inflammatory disease, okay? So most of the time it will be around the lower abdomen, but also miscarriages like threatened miscarriage, inevitable miscarriage, and incomplete miscarriage will also come with crampy lower abdominal pain. So every time you just get abdominal pain, especially at the lower abdomen, please do not stay at home. Rush to the hospital. Now, pain on the flanks or pain on the sides of the stomach can either be an ectopic pregnancy. It can be either the ovary has twisted, what we call ovarian torsion, or it can be a ruptured cyst, okay, ovarian cyst, or any other, or even infection like infection of the fallopian tube, okay, or infection of the ovary, or what we call uveitis or salpingitis, okay. So anytime you have abdominal pain and you're pregnant, okay, especially the first trimester, please do not stay at home. Rush to the hospital and we will be able to help you. We'll be able to do some good history, physical examination, and some tests to be able to ascertain exactly what is causing that pain so that you're able to receive quality care and be able to have that baby grow without many complications. The third danger sign that you need to be aware of, which I had already alluded earlier, is excessive nausea and vomiting, okay? What we call hyperemesis gravidarum. Now, hyperemesis gravidarum is caused by excessive production of a hormone called beta-HCG, which is basically a hormone that is produced by the placenta. And we say those who are at risk mostly are people who are carrying multiple pregnancies, okay? So if you are carrying either twins or triplets, but also there is a type of a pregnancy called a molar pregnancy, which is a false pregnancy, okay, that ends up producing a lot of this hormone, and it can actually lead to excessive nausea, vomiting, and with excessive nausea and vomiting, you basically become dehydrated, you'll end up having electrolyte imbalance, you will have loss of appetite, therefore you will end up having nutritional deficiencies. And if you have these nutritional deficiencies, it means then therefore that you will end up with the baby might end up lacking these nutrients like the folic acid, and you might end up with a baby that has some congenital anomalies. Therefore, do not wait, okay? If you experience this excessive nausea and vomiting, please go to the hospital. There are some drugs that will give you that will be able to help you out, and you should be able to be okay. Now, the fourth danger sign that you need to be aware of is pain when you pass urine. So pain when you pass urine most of the time will be as a result of infection, especially lower urinary tract infection, that is infection from the bladder all the way to the urethra out. The fifth danger sign that you need to be aware of is abnormal vaginal discharge. So the normal vaginal discharge is clear, okay, but then we have abnormal vaginal discharge, whereby it could be either whitish vaginal discharge, yellowish, or even greenish. For whitish vaginal discharge, it might be associated with itchiness around the genital area. It might be a sign of vaginal candidiasis. But if you have also like yellowish to greenish discharge, which is false smelling, associated with itchiness, and sometimes brownish discharge, it can be suggestive of all those infections that can cause pelvic inflammatory disease, such as Trichomonas vaginalis, gonococcal, and all that. So anytime you have abnormal discharge that is not clear, please do not just stay at home. Go to the hospital, to the nearest hospital, get checked and be treated so that that baby is able to be protected. And as we had said, okay, like painful micturition or infection in the bladder is by far the second or the third most common cause of miscarriage after the chromosomal abnormalities that we will discuss at some point. The sixth danger sign that you need to be aware about is persistent or severe headache, dizziness, blurring of vision, fainting attacks, and that one comes hand in hand, especially when you have lost a lot of blood, okay, or even when you probably are having high blood pressure in pregnancy. So if you have lost a lot of blood, especially during this time when you're having miscarriages, or even when you're having an ectopic pregnancy that has ruptured and therefore you have a lot of bleeding that is happening in the stomach, you can lose a lot of blood, and that one can lead to blurring of vision, dizziness, headache, and even fainting attacks. But also, if your blood glucose level goes down, you might also have some fainting attacks. So by far, these are the major danger signs that you need to be aware of, that anytime you experience this or your loved one experience any of this, please do not stay at home. Rush her to the nearest hospital so that they're able to be evaluated and they're able to be given the best care so that the mother and the baby are able to be taken good care of. Now, if you are new here, please consider subscribing to our YouTube channel, that is Doctor on Wheels, and turn the notification bell as well so that you are notified. You can also comment if there is a topic that you will want us to look at. Please just comment and I will take time to be able to read your comments and be able to respond accordingly. You can also visit us at our hospital. We are located at Zawadi Premier Hospital. We are located at Lubsil Center, that is in Ngong, opposite Juanco petrol station, and we will be able to give you quality service that I am sure you will be able to like. So until next time, God bless you.